In an exclusive interview, Navika Kumar, the editor-in-chief of Times Group, Nav Bharat, caught up with Bill Gates Foundation founder Microsoft to discuss the state of Indian healthcare. Now, Bill Gates says India's performance was far better than any other country during the pandemic, and he also praises various government initiatives taken during the process. Listen into this slice of the conversation.
India now in health, the focus on foundational learning is a fairly new thing in the last few years. NIPN, which is a really great program that we want to help accelerate the progress on that. So yes, India's, it's more than a glass half full in terms of the great work.
In India, the political discourse is rather shrill. Many people compare the pace of growth in the last 9 years and before that. Do you see any change in approach of governance, especially in the areas that we're talking about in the last 9 years since the Modi government?
Well, the progress numbers I look at go all the way back to the year 2000, so there's been progress. I will say that the quality of the government staff involved in health work or education work or this digital work, including the financial services, that quality continues to go up. India has a number of great people. The fact that a lot of them are being picked to serve in key government roles, that's a big positive trend, really I'd say of the last 5 years in terms of my noticing that bodes well for the future.
Mr. Bill Gates, we've spoken about the pandemic experience. How do you think India handled the pandemic? Are there any lessons to be learned on what could be done better? And which were the areas where we did, as a country, perform well, better than expected?
Well, India did well compared to all countries in terms of making vaccines. We worked with partners like Serum to help them get going, but that resource was not only great for the country, but also for the world. The digital approach with Cowin, where you were able to see, okay, which communities were not accessing the vaccines. And then as we realized it was the elderly that we wanted to emphasize, then really trying to get them the coverage there, which is the greatest risk up. No country did a perfect job because, we didn't expect the pandemic, and so we were all scrambling to get going. Even the United States was quite a disappointment in terms of how prepared they were to scale up the diagnostics. And so there's a lot of great talk about, okay, we need better surveillance to catch these things earlier on.